Okay.
Good afternoon, everyone. I'm Michelle Steele, the chairman of the Orange County Board of Supervisors, and thank you for all joining us today. Today, the County Health Agency has announced an additional 56 confirmed cases of COVID-19 and 3 more deaths. This brings out our total to 656 cases. Of that total, we have 13 deaths. We currently have 115 active cases hospitalized and 47 in intensive care units. Many Orange County residents are currently dealing with the emotional and economic issues related to COVID-19. My heart goes out to everyone during this time, and please know that we at the county are working hard to assist you. At last week's Board of Supervisors meeting, Vice Chairman Doe and I asked county staff to create a comprehensive list of resources and put them on one website to better assist Orange County's residents. We understand that many of you are looking for resources and even possibly ways to assist your neighbors. I am proud to say that we are launching this website today, and it may be found at covid19info.ocgov.com. The website can also be found right behind me. On the website, you will find a wealth of information about relief for small businesses and individuals of all ages. Please note that this website will be expanded and updated by the county to better assist you. In addition to the website, it is important to remember that treating one another with kindness is also incredibly important. Unfortunately, there have been incidents where someone's race or nationality have been used to target them for hate crimes related to COVID-19. On March 14, a man stabbed 3 members of an Asian American family. 2 of the victims were children, ages 2 and 6. The suspect said he attacked because he thought the family was Chinese and spreading coronavirus to the public. I condemn this kind of hateful behavior in all forms. We in Orange County must stop the hate and work toward helping our neighbors at this time. We must remember that this virus doesn't discriminate. Today, you will hear from Social Service Agency Director Deborah Bates and Orange County Community Services Director Dylan Wright as to where you can turn for resources and assistance as well. Dr. Quick will also be here to provide an update from the healthcare agency for you all as well. And lastly, I wanted to provide Orange County residents with an update on the use of Fairview Developmental Center. Yesterday, the state announced that Fairview site will be used as an alternate care site to serve patients in Orange County. The Fairview site, in partnership with the healthcare providers and the county, will serve as an alternate care site to relieve stress on hospitals in the surrounding region. Again, I appreciate you all joining us today, and I'm inviting Deborah Bates from Social Service Agency to speak. Deborah.
Thank you, Chairwoman Steele. Good afternoon, everyone. So the Social Services Agency has been receiving a lot of questions, mostly surrounding where our community can go for needed services, especially those that have been displaced in the workforce. So today I want to talk a little bit about our safety net programs, and by its very nature, a safety net is exactly that. It is a program that is there to provide support to us during challenging times, such as these. Adults, children, and families who find themselves facing hardships can apply for, receive, and maintain public health insurance, food, and cash benefits through our Medi-Cal, our CalFresh, our CalWorks, and our General Relief programs. While SSA offices are closed to the public, residents should be ensured that we are still there working each and every day. We are still accepting applications, we are still supporting active beneficiaries, and we are still answering your calls. Finally, we are still issuing emergency benefits. We encourage our residents to apply for services through two primary portals of entry. The first is the mybenefitscalwin.org website, as well as our SSA contact center that can be reached at 1-800-281-9799. In order to help our community in this time of need, SSA has expanded our hours of operation in our contact center. We are now operating Monday through Friday from 6:30 in the morning till 8 p.m. and on Saturdays from 7 a.m. to 4:30. In order to address the increased need, the Social Services Agency is redirecting and redistributing staff to the appropriate entry points to ensure that we are expediting application processes as quickly as possible. Additionally, our state regulatory agencies have implemented regulatory changes that allow for our beneficiaries to maintain their eligibility, allowing for diversion of critical staff to approving new applications. Such changes include deferment of annual redeterminations and exemptions of periodic reports. So we are collectively here to help serve you. Additionally, for our senior populations that require assistance with home health care, our in-home supportive services program is the place where you should go. Check on your ongoing case or apply for new IHSS services at area code 714-825-3000. Additionally, state regulatory agencies have also deferred redeterminations so that, again, we can critically divert staff to supporting the vulnerable senior population. On that note, I would like to share that SSA staff have reached out and completed wellness checks on over 29,000 in-home supportive services beneficiaries, checking in to ensure they have the critical resources they needed, making note of what they lacked, and making connections, which included delivery of food and other adult service supplies such as nutritional supplements and incontinence supplies. But we are not alone. This is not just SSA's charge. Currently, in the Orange County Emergency Operations Center, there's a group, our Mass Care and Shelter branch, that is working very closely with our city partners, our community-based organizations, our homeless services branch, and other key department areas. Together, they are planning for unmet needs. They're reaching out on an ongoing basis to both social service providers and policy agencies for Leisure World senior communities in Laguna Hills and Seal Beach to determine unmet needs. They are working closely in encouraging volunteer and donations of our Second Harvest Food Bank, as well as our OC Community Food Bank, who continue to supply needed food distribution in our communities. They're also heavily working on donation management. Currently, OC Rescue Mission is the donation collection point for physical donations such as baby diapers, baby wipes, sanitizing wipes, adult diapers, nutritional, just to name a few. United Way and the OC Resilience Fund are also accepting monetary donations that can be distributed to key critical community-based organizations who are serving our impacted populations with needed supplies and resources. Additionally, OC 211 continues to be a go-to point for connection to all available community resources. We've received many questions from individuals, from communities, from organizations, asking one question: how can I help? There's a lot of ways the community can help. One way that the Emergency Operations Center is working is to collect volunteers. OC is the organization that is collecting the names of community members who just wish to help us offer support. Individuals who are interested in volunteering can do so through oneoc.org, and currently, I'm very proud this morning, we have 108 volunteers on that list today. But yet the work is still not done. We're also planning for unmet child care needs of our first responders and healthcare professionals. First Five Orange County, in collaboration with the local Child Care Planning Council, is working to survey our current child care providers, determine who's still opening, determine what barriers to remaining open they may have, and ensuring that there's connections to the critical resources they need. Finally, the last thing I want to touch on is some critical areas of our safety protection programs. I want to begin first with our children and family services. At a time where our children are not in school, we must remain vigilant. We must keep an eye as a community on high-risk youth. And I want to remind the public that our child abuse registry remains open. Our child abuse investigators and our emergency response staff continue to investigate these allegations. That team mans those phones 24/7. Our child abuse registry number is 1-800-207-4464. Finally, our Adult Protective Services unit. Again, that unit continues to report to work. We are continuing to respond to those emergency situations. We are still accepting reports. Our APS hotline can be reached at 1-800-451-5155. If you believe that there is a youth at risk, or an adult at risk, or a senior at risk, please reach out to these point of contacts. Together, we will get through this. On a closing statement, I just want to assure everyone that SSA continues the essential work of addressing the ongoing evolving impacts of COVID-19. We're here to provide critical public assistance benefits. We're here to protect the safety and well-being of our most vulnerable populations. We rely on and appreciate the strength of our collaborations with elected officials, Orange County agencies, and community partners to ensure that we meet the needs of our community during this challenging time. Now more than ever, we depend on the support and vigilance demonstrated by neighbors and residents in the community to ensure our children, our seniors, and our disabled populations remain safe and protected. With that note, I'm going to turn it over to my peer, Dylan Wright, who will be providing some additional information. Dylan?
Thank you. I'm grateful to have this opportunity to share information about services from the Office on Aging for the seniors in our community. Seniors in our community are among the most at risk during this time. The county has been working diligently since stay-at-home guidance was issued to increase support for our seniors. The Office on Aging has an information and assistance call center, which includes a trained team ready to make connections for our seniors. The call center has extended hours from 8 a.m. to 8 p.m. during the week and from 8 to 5 on weekends. Resources include transportation, food, household supplies, and other items essential to daily living. The call center has received over 2,000 calls already this week, which is roughly 6 times the normal call volume, and a concerted effort is ongoing to continue to reach out to seniors in Orange County, those 60 and over. 500,000 seniors will be getting calls this week to identify those most in need so that they can be connected to the resources that are available. Senior meal programs, for instance, are for those in need. Senior meal programs, including pickup and home delivery, continue to operate, and service has expanded from about 10,000 to 13,000 seniors during this time. Frozen meals are being offered, a 7-day supply on single delivery or twice delivery as opposed to every day of the week, to minimize the contact and also to maximize our volunteer services. In anticipation of a surge in cases in the coming weeks, meal service capacity has been further expanded and is ready to, and we're ready to assist those most in need as they call in the coming weeks. We all have an opportunity to check on and support our seniors, our neighbors. So the Office on Aging developed a communications plan to encourage residents to check on their senior neighbors by calling, texting, or reaching out, especially to those who live alone. Residents can help their senior neighbors by checking to see if they need groceries, medications, things such as that, necessities for daily living, asking if they have someone they can contact in case of emergency, And if you go to the Community Services website, which is communityservices.org, you can download a Hello Neighbor card to let your senior neighbor know you're thinking of them and that you're available should they have a need. So in closing, if you or someone you know is an older adult living in Orange County and needs resources, the county has established a hotline to connect residents with services and information. So specific to seniors, if you call the county's hotline, which is 833-426-6411, and select option 5, you'll be connected with the Office on Aging and they will be able to assist you. And you can also, as I mentioned, visit OC Community Services, all one word, .org for additional information. Thank you, and I will turn this over to Dr. Quick.
Good afternoon. I'm Dr. Nicole Quick, County Health Officer. Yesterday, the California Department of Public Health issued some new guidance on face coverings for the general public. I want to make sure that everybody understands what this guidance is really meaning for the population in Orange County. From the beginning of the COVID-19 response, we have suggested that various groups of individuals wear face masks. Those include healthcare workers as well as individuals who are feeling ill. That guidance continues today, and I want to reiterate that this guidance from California Department of Public Health is not asking the general public to wear either surgical masks or N95 masks. These guidance relates to a cloth face covering that individuals may choose to wear if they feel comfortable in public. The idea here is to put something over individuals' faces to help stop the spread of COVID-19 by stopping any respiratory particles from spreading to your neighbor. Once again, I want to reiterate that this is very important that we are not asking the general public to purchase N95s or surgical masks as they are needed by our healthcare workers at this time. Thank you.
Thank you, Dr. Quick. At this time, I would like to open up to members of the media for questions. Moderator, can you please let us know who we have on the phone line at this time?
Ladies and gentlemen, from the media, if you do have a question, please press 1 and 0 on your touch-tone phone. You'll hear an indication you've been placed in queue, and you may remove yourself from the queue by repeating the 1 then 0 command. If you're using a speakerphone, we ask you to please pick up your handset before pressing any buttons. Also, we urge you to make sure that your phone is unmuted before you press any buttons as well. Again, for questions at this time, press 1 then 0. One moment please for our first question.
And while we wait for our first question, I encourage all of our residents to visit ochealthinfo.com/novel coronavirus for the latest information. So again, please visit our website. We have our resource page as well as information on the coronavirus, and those are always updated daily, and we hope that you'll visit us and learn more about this virus.
Our first question will come from the line of Jessica DeNova with ABC7. Go ahead.
Emails and calls from concerned residents in Laguna Woods Village about the designation of the Aries Hotel within the village as a place to house COVID-19 homeless patients. Can you confirm that and tell us how the county health agency or who made that decision and how that decision was made? We're told that the city nor the residents had a say in this.
So in terms of the response to homelessness, as we're all aware, the governor has issued an order and directed that we identify locations to support the homeless response as it relates to COVID. First off, there was a direction and guidance to reduce the density of homeless individuals within our shelter environment. Additionally, there was guidance related to taking those individuals that were at most risk, and those are the homeless individuals that are over the age of 65, those with underlying health conditions, and those that were showing symptoms of COVID or those that were positive for COVID. And we are aware that in many of the cities have established moteling programs for just that population, and county as well has a similar responsibility. So our healthcare agency, which manages our homeless response, was given the directive to identify multiple sites throughout the county. One of those sites is in the city of Laguna Niguel. And again, I would share with you that speed is of the greatest importance. And as the governor has indicated, our ability as a community to share this incredibly difficult burden, as well as respond as quick as possible to isolate these highest risk individuals and provide the necessary medical and provision of services within kind of this motel environment is something that we were directed to do, and we did identify that as one of the many sites across the county.
Okay, what are the other sites? And according to the city, more than 80% of Laguna Woods residents are 65 and older, so their concern is they are part of that at-risk population, and they fear that they are being put at further risk by having COVID-19 positive individuals housed in their city. So what do you say to that particular concern? And then again, what are the other sites?
I think it's, thank you for that question. Again, we have sites spread throughout the county for multiple purposes. I know that we have heard about the Joplin Youth site that the county is reestablishing to use for this purpose. We're also using regional park sites within geographically distributed throughout the county, and we have ordered sprung structures, and we're using that to reduce the density of homeless individuals within our shelter environment. In terms of the other moteling sites, we're in conversations with those cities in terms of sharing the operational programming as well as the security and all of those concerns, as you can imagine, that the residents in those communities have. So that dialogue is happening today, and as that dialogue is complete, we will reveal those sites to all.
Okay, and then my last question, thanks by the way for your time. Last question is, there are 5 trailers making their way to Orange County if they haven't already arrived. It's my understanding some are on their way to Anaheim or have arrived in Anaheim, Santa Ana, and there are 3 other cities that those trailers will be going to. Do we know what those cities are?
Yes, I don't have them with me, so I'd have to check with my staff, but I do know that the city of Anaheim and the city of Santa Ana have made requests for those trailers, as has the city of Costa Mesa. The other 2 cities, I am aware of those, I just don't have that information with me, and we can provide that at a later point. If you contact our Public Information Office, EOC PIO, then we can provide that to you directly.
Okay, thank you. And these are the FEMA trailers, are they here yet?
They have not arrived yet, but there were 39 allocated initially to the city of Anaheim and 39 to the city of Santa Ana. They had their first right of refusal to accept those, and my understanding is Anaheim has accepted all of their trailers, and Santa Ana has taken delivery of, I believe it was 22, and the remaining allocation from Santa Ana is being distributed to other cities that made requests through our EOC.
Okay, thank you for your time.
Thank you.
Our next question will be from Margaret Guerrero with KNS. Please go ahead.
Yes, this question rather is for Dr. Quick. If you could maybe talk a little bit more about the 3 new deaths and what do we know about those individuals? And the press conference started a little bit late. I was hoping that we could have Ms. Michelle Steele come back up as well and kind of talk a little bit more about her opening statements, and again talk a little bit more about that family that was attacked.
Yes, I can't make any comments about what the chairwoman said earlier. To speak to the new deaths, I do not have any more case details than what has already been released at this time, but again, we continue to post new data daily. And I believe that was the aspect of your question that I could answer at this point.
Right, is Ms. Steele there to maybe address her own comments earlier and speak about that family?
Chairwoman Steele had another appointment, so she had to move on to that. If there's a question that I can refer to her office, I would be happy to do so.
Just like I said, the press conference started a little bit late online, and so we missed some of her opening statement.
So our normal cadence is on Mondays and Thursdays, we start right at 2 o'clock. That is what we will try to do every week so that we can set that expectation for the media and the community.
Thank you.
Our next question will be from the line of Alicia Robinson with the Orange County Register. Go ahead, please.
Thank you. This is a question for Dr. Quick. Can we tell yet whether the stay-at-home orders have started to make any difference, not only in the spread of COVID-19, but I've seen news reports from elsewhere that there have been drops in traffic accidents, for instance. The number of flu cases have gone down. So have we started to see any kind of a difference in public health outcomes so far based on the stay-at-home orders?
Sure. So what I want to point out is, as everyone is aware, we are updating our website daily with new cases as well as a graph that shows the trend over time. And I want to urge everyone not to take a single day's point in time as far as number of cases to mean anything other than that. It's really important for us to look at the trend and what the number of new cases is doing over a period of time. We are only partially through the stay-at-home order. At this time, I would like to remain hopeful that we are going to have an effect by all of these measures that we're asking people to do, but once again, we have to continue to follow the trend. As far as a decrease in traffic accidents, I'm not the correct person to speak to that. As far as decreases in flu, right now we are at the tail end of our flu season, so hopefully that these measures we're asking people to do, and once again I'm going to take the opportunity to remind everybody to cover coughs and sneezes, wash your hands very frequently, and most of all heed both the governor and the state and local health officials' recommendation to stay home unless you're engaged in essential business or essential work, and that should help to decrease both the COVID as well as any flu. Thank you.
And for our next question, we'll go to the line of Spencer Custodio with the Voice of Orange County. Go ahead, please.
Hi, this question would be for the Social Security or the Social Services Administration, I believe, but I just am wondering, do you guys have any statistics on the spikes in applications for, the general relief or CalWorks, CalFresh, and also if the county has any numbers or any idea on how many people have filed for unemployment since the stay-at-home orders came down from the state?
I'm not the right person to answer the unemployment question. As far as seeing increases in our request for public assistance, yes, we have. So in the last 2 weeks, we've seen over a 65% increase in our call volume to our contact center. We're averaging about 4,000 calls per day. And what I can share is that our application volume is also up. In the last 2 weeks, we have accepted over 12,000 applications for all of our public assistance programs, which is an increase drastically over our 2-year average. At the end of last week, we're at 10%. Based on this week's volume, I believe we're hovering around a 15% increase in application volume at this time. But we do expect.
Okay, thank you. And
I'm sorry, I just wanted to add that we do expect that the increases will continue over time.
Excellent. What, before, this all kind of happened, what would be the average volume per week, the average kind of call?
We were averaging about 2,500 calls, I believe, close to that 2,000 mark. And like I said, we've seen a 65% increase. We're averaging about 4,000 per day.
Okay, cool. Thank you.
We'll next go to the line of Nick Gerda, also with the Voice of Orange County. Go ahead.
Hi, everyone. Thank you for this update and this opportunity to ask questions. I have 4, which I'll try and go through as quickly as possible. The first is on property taxes. The deadline is coming up technically on April 10th. There's not an extension of the deadline. A lot of property taxpayers wondering what kind of relief there is if they are losing income due to COVID-related business closures, et cetera. Last week, there was an indication that there would be relief offered through waivers that people would have to apply for. The latest things we're hearing out of Treasurer Tax Collector is that loss of income would not qualify for a waiver of late penalties. I just want to get clarity on the county's position on what kind of relief on property tax late penalties there will be for people who lose income due to COVID, if any.
So on questions of property tax, we know very clearly that the authority to address those requests for relief, both in terms of interest and penalties on late payment, that resides with our treasurer tax collector. So I know that she is very engaged on this issue and has been working with her team to identify exactly how to manage the type of requests that we'll get. We know that all treasurers across California in their counties are getting similar questions. So I'm aware that she's taking this effort on very diligently. She's talking with her peers in other counties, and she will manage this well, and I expect that she'll have additional communication with all those individuals and businesses that have that type of question.
Second question on people who are homeless without shelter. The county's pandemic response plan notes that homeless encampments are a higher risk for people getting infectious diseases spreading. As of the last homeless count, there were 4,000 unsheltered homeless people in Orange County. We've heard from homeless people who are trying to get into shelter from the streets, having a hard time getting in. And just curious, kind of the county's position, the message to homeless people on the streets who want shelter with social distancing to prevent COVID spread. Where should they be going, and what bed capacity is currently available for people who want shelter?
Thank you for that question. I think the county and the cities working cooperatively have done an outstanding job in recent years in building the shelter capacity. Just the last 2 days, the city of Placentia working jointly with other North County cities, also with funding support from the County of Orange. They opened up their new navigation center, which I believe houses approximately 80 homeless individuals, and I believe that a significant portion of that capacity has been utilized. So we do know that in the recent days that the city of Placentia has done an outstanding job of bringing homeless individuals from the street into a sheltered environment where they're provided outstanding services. Additionally, we know that our access to the cold weather armories was reduced because of the activation of the National Guard for their COVID response, and we're happy and pleased that we were able to work within our jurisdictions, and we've located alternate sites that we're running 24/7, which wasn't the case for the armories. So now we're running those 24/7, and each of those sites is housing 100 individuals. So I think that we've done a very good job in meeting this immediate need, and we do know that the county also is working on the construction for its Yale facility, which will transition the courtyard facility into a more suitable environment for the number of homeless individuals that reside in the central part of Orange County.
My understanding is the state has asked for 2,300 additional shelter beds, and with the downsizing of the armory shelters and even with the addition of Placentia, we're still about 2,300 beds away from that, maybe a little bit less. What's your assessment, Frank, of where Orange County is at and what may be needed to meet that goal, or if that still is the goal?
Well, I think all jurisdictions are challenged with the same hurdle to overcome with respect to COVID. So in terms of finding the appropriate number of alternate kind of non-congregate bed facilities, that's difficult. I have conversations with my peers in other counties frequently, and we're all challenged to try to find the best site. And as you heard earlier, I think that's part of the difficulty, is trying to identify sites that are most suitable within the capacity of each jurisdiction to manage. So I think what you're pointing out is that across the state, the need for sheltering of homeless is a significant need, and it's a resource issue, and counties are doing their best to meet that need head on, and particularly within the kind of accelerated time frame that we've had. I'm really proud of the county team for bringing up our Joplin facility, as well as finding alternate sites for the armories, as well as identifying initially some of the hotel sites and tent sites that we're working with local jurisdictions on today. So thank you for that question.
Sure. And last two questions I had. The courts have been closed now for, I believe, a couple of weeks. Two of the county services for vulnerable folks that directly are entitled with the court services are child protective services, adult protective services, investigations. I'm kind of curious the status on that, if those investigations are still proceeding with the court shut down, and what, if any, challenges remain that can be overcome to ensure that people are protected.
I'm not sure that I'm the best person to respond to that. What I can share with you is that I've had discussions with my department heads, and as far as having access to a judge to get the necessary orders to complete our investigation on adult and child protective services, that those activities continue, and the courts have been incredibly supportive, and we've not had any issues with respect to getting that type of access.
And looking forward, there's been forecasting of a surge of cases. We've seen national models, statewide models that have gone public of the where we're projected to head in terms of hospitalizations, ICU beds. I understand Orange County has been developing a model locally as well. It's roughly similar to the general trend we're seeing across the state that's predicted. I was curious if that Orange County specific model is something that the county is interested in sharing with the public, and if not, why not? And whether the county believes that's information that could be helpful for the public and healthcare providers to know.
Thank you for that question. I'll ask Dr. Quick to address.
So yes, you are absolutely correct. The county has been involved with running various models, including looking at models done by the state, as well as some other publicly available models. We are also working as a region. We're part of Region 1 as far as responding to hospital surge. And we are working actively with our region to ensure that we have capacity to meet this. Some of that capacity you can see, or actions coming out of that are alternate care sites such as Fairview. So as far as sharing specific numbers, we do have numbers that if you had a specific ask for number of hospital beds and so forth, we'd be happy to follow up and give that to you.
Yeah, thank you for inviting us. I'd say that the main question would be kind of timeline of what we're projecting as far as peak cases, or the highest point of the number of hospitalizations we're going to see, and then what that come down is. I think the statewide model was showing from the University of Washington for California that later in April, early May is when there's going to be the pinnacle of the number of hospitalizations, and then it's kind of coming down until early July, assuming social distancing remains in place. Just kind of the general sense of the timeline from here that's being foreseen for what people should be expecting.
Yeah, I think you did a great job outlining it right there. We are expecting for our surge to start, I'd say, a week or 2 weeks from now, with things getting even more, I'd say more demand on our healthcare system early May. Once again, I want everybody to realize this is sort of a work in progress. As we see how effective our social distancing measures have been, we will continue to adjust. But we are planning for a surge actively. We're working with our hospitals. We're working within our region to make sure that we have capacity, and we do expect to see more demand on our healthcare system in the coming weeks.
Big concern that's been out there is on PPE, personal protective equipment like N95 masks for frontline responders, sheriff deputies at the jails, as well as hospital workers, et cetera. We've been hearing anecdotally of rationing of masks at healthcare facilities for people who are treating COVID patients. Where are we at with getting the PPE that's needed and the projection going forward? How far are we short at this point, and what can be done to get that in place?
Yeah, a couple points to make on this. We are currently asking all of our healthcare providers and facilities to sort of follow the CDC guidance on personal protective equipment in times of scarcity. So I'm not going to speak to conditions at any given healthcare facility, but what I can say is we continue to receive requests from our healthcare providers and facilities. We route those requests through our normal process, and we are receiving personal protective equipment and redistributing that. We are not getting everything we've asked for. I want everyone to understand we definitely have limited personal protective equipment across the entire country right now. We will continue to request that and do our best to meet everyone's orders.
We have a question in queue from the line of Paul Anderson with City News Service. Please go ahead.
Yesterday they had a trial over at the Central Justice Center, and I was wondering what the thoughts were on the wisdom of doing jury trials over at the courthouse. right now, when I thought that most of the activity was going to be restricted to, hearings, not having juries called back to hear evidence. They say that they enacted social distancing, but I just wondered what your thoughts were on that.
I really can't speak to decisions of the Chief Justice of the courts from the state of California. I'm aware that the governor delegated that authority to the Chief Justice in terms of managing the court system across the state. As our local courts interpret those directions and guidance, and they administer their courts, obviously there's a requirement in there for our staff, not only our public defender, probation, and district attorney, but the team that supports that court function. So I can't speak to the specifics of what's happening in a particular courtroom with a particular judge, but I know that they're making informed decisions, and I am aware that all the county departments that participate in that court process with respect to our services, they have frequent meetings and discuss those operations. And I believe, as you're aware, kind of the operations and management of the courts has been an evolutionary process over the last several weeks, and I think they continue to calibrate what the right level of functioning and how they can manage the social distancing. So I'm aware that they're looking into it very closely. I just can't speak to the specific directions from the Chief Justice.
Okay, thank you.
And as a reminder, ladies and gentlemen from the media, if you do have a question, please take this opportunity now to press 1 then 0 on your touch-tone phone. We have a follow-up question from Jessica DeNova with ABC7. Go ahead. Ms. DeNova, we seem to have lost your line. If you would like to press 1 then 0 again, we'll open your line back up. Again, Ms. DeNova, if you would press 1 then 0 at this time. Okay, we'll open Jessica DeNova's line up. Go ahead.
Hi,
Ms.
yes,
DeNova.
that's full. Can you hear me? I don't know if this is for Dr. Quick, or who might be able to answer this. So the death toll that we're seeing for COVID-19 related cases, is this coming from people who have died in the hospital? Because right now we are telling people if you're symptomatic, stay home, call your doctor. You only need to go to the emergency room or the doctor if you're having trouble breathing. Is there a chance that we are having deaths that are not being reported that are COVID-19 related? Perhaps they are, categorized as a natural cause, and then aren't at all being tested after the fact?
Yes, so thank you for that question. As far as the breakdown of every case we've had here, I'm not going to speak to the characteristics of each one, but in general, individuals who test positive for COVID-19 are mild to moderately ill, we are asking them to stay home with the understanding that if they become ill, they will go into a healthcare facility and call ahead and let that facility know so that appropriate precautions can be taken. If there is a death that is unexplained in the county, be it in a home or a hospital, we have worked with our coroner to do some increased surveillance on that to find out if it is related to C19 or COVID-19.
So you're confident in the accuracy of the death toll, the death count? I mean, I guess my question is, from having spoken with people who work with the coroner's office in the past, if someone has some sort of history, they can be categorized as a death by natural cause, and they'll go straight to a funeral home rather than through the coroner's office. So is there a chance that this is happening?
Yeah, I think we are making a concerted effort in the county right now to make sure that hospitals are aware, and I can tell you that hospitals are very well aware of testing people for COVID if the case history suggests that, including severely ill that don't have another explanation. So I feel like we would be capturing that in the hospital, and we have brought the coroner into the discussions to also test more during those autopsies if it's suspected. So I think we're doing a good job capturing that right now in Orange County. Thank you.
Okay, I appreciate that, but I just want to make sure that I'm being clear that my question is more about people at home. people who don't make it to the hospital, possibly someone who is elder or a member of a low-income community, or just someone who, for whatever reason, does not make it to the hospital, appears to have died of natural causes. How are we gathering that information, and are we making sure that these people perhaps didn't die of COVID-19 and we're categorizing them or counting them?
All right, thank you for your question. Yes, that was the coroner testing for people who have died at home. Those individuals would be seen by the coroner at this point. Our system right now in Orange County is not seeing the amount of deaths that would lead us to be thinking that we're missing the number of COVID deaths at this time.
Okay, thank you for your time, Dr. Quick.
And we have a question in queue from the line of Vicky Vargas with KNBC. Your line is open.
Hi there, thank you very much. Voice of Orange County had a story today that I'd like to hear straight from the horse's mouth as to what this was or wasn't, regarding some N95 masks that were allegedly auctioned or sold. They're deemed to be either deteriorating or inappropriate. Can you put that into perspective, and why, looking back a few weeks, those would have been released at all?
Sure. Thank you for that question. So back in middle of January, we were in possession within our healthcare agency of approximately 400,000 expired N95 masks. Approximately 100,000 of those were the type of N95s with an elastic band, and the other 300,000 were those that had a fabric band. And staff did a review and examined our inventory of expired masks, and they identified that those with the elastic band, approximately 100,000 in number, had the elastic that was deteriorating, and they made an assessment that because of the condition of the elastic band, that it could no longer provide the tight, secure fit that's required for that mask to function appropriately. In addition, it was expired, so they made a decision at that time to surplus those masks that had that elastic band that was deteriorating, and they immediately placed an order for fresh new N95s, knowing that we obviously need to replenish our supply. The 300,000 N95 masks that had the fabric band, they did an assessment of those as well and determined that they were still functionally appropriate, meaning that they could maintain the secure seal that is required for these masks to function appropriately. And we held on to those because we knew that they could be reused. And on February 28th, we're aware that CDC released revised guidelines on how to use expired N95s, and those are being used today.
So that was my question. There have been updated rules regarding masks.
Right.
Like
And even if we held on to those other 100,000, in order for them to be placed back into use, we would have had to open the package and modify them and replace all of the rubber elastic on them. So that was a decision that was made back in January to replace those with obviously not expired fresh N95s. And since that time, the county has received approximately 1.3 million new N95s.
Thank you, Frank.
Thank you.
And speakers, we have no further questions in queue. You may proceed.
Well, thank you for your time. I appreciate everyone participating on this press conference. We look forward to our next event on next Monday. Thank you.
Ladies